6 weeks ago, my patient walked in with blood pressure 182/99. His doctor wanted to add a third pill. Instead, I gave him a simple list of 7 foods to eat every day. Last week, he returned 110/70, 0 new medications. I am Dr. Elliot Grant. What I am about to share with you took me 25 years of cardiology practice to perfect. Food number 4 alone can drop your systolic pressure by up to 11 points within 3 weeks. Let me tell you about Frank. Frank is 71 years old, a retired construction foreman. He spent 35 years on job sites, working hard, raising 2 kids, and never complaining, but his body started complaining for him. Frank had been on blood pressure medication for over a decade. At first, one little pill worked fine. His numbers were around 130/85, not perfect but acceptable. Then, as the years went by, his blood pressure crept back up. So his doctor added a second pill that worked for a while, but eventually, his numbers climbed again. Then a third pill. When Frank walked into my office 6 weeks ago, he was taking 3 different blood pressure medications every single day, and his blood pressure was still 182/99. That is dangerously high. I want you to understand what those numbers mean. The top number, 182, is the pressure in your arteries when your heart beats. The bottom number, 99, is the pressure when your heart rests between beats. Normal is around 120/80. Frank was in the red zone for a stroke or heart attack. He had constant headaches. He was short of breath just walking to his mailbox. His ankles were swollen, and he was terrified of dying in his sleep. His doctor wanted to add a 4th medication, but Frank came to me for a second opinion. He sat in my office, his hands trembling, and said, "Dr. Grant, I am already taking 3 pills. I feel tired all the time. My legs swell. I cannot afford another prescription. Isn't there something else I can do?" I looked at Frank. He was not eating badly on purpose. He loved his wife's cooking. He ate what most Americans eat: meat, potatoes, bread, canned vegetables, and the occasional salad. He just did not know which foods actually lower blood pressure, so I gave him a simple list of 7 foods to eat every single day. No expensive supplements, no weird juices, no starvation diets, no meal replacement shakes, just real, common, affordable foods you can buy at any grocery store for a few dollars. Frank went home, showed the list to his wife, and together they changed their grocery list. 6 weeks later, Frank walked back into my office. He was smiling. He had lost 12 pounds without trying. His headaches were gone, his energy was back, he was sleeping better, and his blood pressure was 110/70. That is better than most teenagers. 0 new medications, same 3 pills he started with. Frank is not special. He is not a health nut. He did not join a gym. He just followed the list. Today, I am giving you that same list. Food number 4 alone can drop your systolic pressure by up to 11 points in just 3 weeks. Let me start by explaining why pills alone often fail, so you understand why food is so powerful. You might be wondering, Dr. Grant, if blood pressure pills work, why do I need to change my food? Why can't I just take the medication and eat whatever I want? That is a fair question. I hear it from patients every single week. Here is the honest answer. Blood pressure medications are very good at forcing your blood vessels to relax and your kidneys to remove excess fluid. They can save your life in an emergency. I prescribe them every single day. I am not against medication, but here is what your doctor might not have told you. Pills treat the symptom, not the root cause. They are like putting a bandage on a wound without cleaning the wound first. High blood pressure is usually caused by several underlying problems: chronic inflammation throughout your body, stiff and narrow arteries, too much sodium and too little potassium, poor blood vessel flexibility, and something called endothelial dysfunction that is a fancy way of saying the inner lining of your arteries stops working properly. Pills can force your blood vessels to relax for a few hours, but as soon as the medication wears off, your blood pressure creeps right back up. That is why most seniors end up on 2, 3, even 4 different blood pressure medications over time. Each new pill adds side effects: dizziness when you stand up, leg swelling, a dry cough that won't go away, fatigue, muscle weakness, kidney problems, and more. Some of my patients tell me they feel worse on 4 pills than they did with high blood pressure, but food works completely differently. The right foods actually repair the lining of your arteries. They reduce inflammation at the source inside your blood vessels. They help your kidneys naturally remove excess sodium without drugs. They make your blood vessels more flexible and elastic. They work with your body, not against it. And because these foods work around the clock, not just for a few hours, the effect lasts. Frank did not stop his medications. He still takes 3 pills, but by adding these 7 foods, his blood pressure dropped so much that his doctor stopped talking about a 4th pill. Some of my patients, after 6 months to a year on this eating plan, have been able to reduce their medication doses under their doctor's supervision. Not everyone, but many. So these foods are not a replacement for your medication. They are a partner. They make your medication work better, so you may need less of it over time, and they have zero side effects except maybe more energy and better digestion. Let me now give you the 7 foods, starting with number 7 and building up to the most powerful one. Food number 7 is flaxseed, not flaxseed oil, not flaxseed supplements, not whole flax seeds, actual ground flaxseed. You can buy it in the baking aisle or the natural foods section of any grocery store for just a few dollars per bag. It looks like a light brown powder. Here is why it works so well. Flaxseed is incredibly rich in something called alpha-linolenic acid, which is a type of omega-3 fatty acid, the same healthy fat found in fish, omega-3. Fats reduce inflammation throughout your body, including the inflammation in your artery walls. Inflamed arteries are stiff and narrow, calm arteries are flexible and wide. Flaxseed also contains lignans, which are compounds that help your blood vessels relax. Studies show that eating about 4 tablespoons of ground flaxseed every day for 6 months can lower your systolic blood pressure by an average of 10 to 15 points. That is as good as some prescription medications. But here is the most important trick. You must grind the flaxseed. Whole flax seeds have a hard outer shell that passes right through you undigested. You cannot absorb the healthy fats and lignans, so buy them whole and grind them in a coffee grinder for 10 seconds, or buy them already ground. Just store ground flaxseed in the refrigerator or freezer because it can go rancid. Add 2 tablespoons to your morning oatmeal, smoothie, or yogurt. Add 2 more tablespoons to soup, salad, meatloaf, or even pancake batter. It has a mild, nutty taste that Frank described as barely noticeable. He put it on his cereal every morning. He did not even think about it. Start with 1 tablespoon to let your digestive system adjust, then work up to 4 tablespoons per day. Do not take more than that. Too much fiber too fast can cause bloating. Food number 6 is beetroot. Red beets, golden beets, beetroot powder, pickled beets, roasted beets, or fresh beets. Beets are one of the most studied natural blood pressure remedies in the world. There are dozens of clinical trials. Here is why. Beets are loaded with natural nitrates, not the artificial, cancer-causing nitrates in processed meats like bacon and hot dogs. Natural nitrates from vegetables are completely different and completely healthy. Your body converts these natural nitrates into nitric oxide. Nitric oxide is like a tiny key that unlocks your blood vessels, allowing them to relax and widen. When your blood vessels are wide, your blood pressure drops naturally without drugs. One famous study from the University of London found that drinking just 1 cup of beetroot juice lowered systolic blood pressure by an average of 10 points within 3 to 6 hours. But you do not need to drink juice. Juice is fine, but it lacks the fiber that helps steady your blood. Sugar. You can eat roasted beets, boiled beets, pickled beets, or even canned beets. Just rinse them well to remove excess salt. Frank ate half a cup of pickled beets with his lunch every day. He bought a large jar from the grocery store. Within 2 weeks, he noticed his morning headaches were completely gone. That was his blood pressure coming down. If you do not like the taste of beets, you can buy beetroot powder online or at health food stores. Stir 1 teaspoon into water, smoothie, or even soup. You will not taste it. Aim for half a cup of beets or 1 small whole beet per day, and do not be alarmed if your urine or stool turns pink or red. That is completely normal. It is just the beet pigment. Food number 5 is leafy greens, kale, spinach, collard greens, Swiss chard, arugula, romaine lettuce, turnip greens, mustard greens, not iceberg lettuce that has almost no nutrients, the dark green ones. These are not just for rabbits, they are powerful medicine for your arteries. Leafy greens are the single best dietary source of 2 minerals, potassium and magnesium. Potassium helps your kidneys flush out excess sodium. Most seniors eat way too much sodium from canned soup, frozen dinners, bread, cheese, and processed meat, and not nearly enough potassium. That imbalance drives your blood pressure up. Magnesium helps your blood vessel walls relax. Think of magnesium as a natural muscle relaxer for your arteries. Together, potassium and magnesium act like a natural diuretic and a natural vasodilator. One large study from Harvard followed over 100,000 people for 14 years. It found that eating at least 1 serving of leafy greens every day lowered the risk of developing high blood pressure by 16% compared to eating less than 1 serving per week. Frank added a big handful of spinach to his morning smoothie. He said he could not taste it at all. He also added a side salad of mixed greens to his dinner. He said it was easier than he expected. Aim for at least 2 cups of raw leafy greens or 1 cup of cooked greens every day. If you take blood thinners like warfarin Coumadin, talk to your doctor first because leafy greens contain vitamin K, which affects blood clotting. Do not stop eating them, just be consistent. For everyone else, eat as many as you like. Food number 4 is the one I promised you in the opening. The one that can drop your systolic pressure by up to 11 points within 3 weeks. Plain Greek yogurt, not sweetened yogurt, not fruit on the bottom yogurt, not yogurt with granola or candy pieces mixed in, not children's yogurt tubes, plain, unsweetened, full-fat or low-fat Greek yogurt. Here is why it is so powerful. Yogurt contains a unique combination of 3 things that work together: calcium, potassium, and probiotics. Calcium helps your blood vessels contract and relax properly. It is not just for bones. Potassium, as I just explained, flushes out excess sodium, and the probiotics, the live beneficial bacteria in yogurt, improve your gut health. When your gut is healthy, your immune system is calmer, and inflammation goes down throughout your body. Inflammation is a major driver of high blood pressure. A landmark study from the American Heart Association followed over 1,000 people for 15 years. They found that those who ate yogurt at least 5 times per week had significantly lower blood pressure than those who ate it less than once per month. The effect was strongest in people over 60, but here is the catch that most people miss: most sweetened yogurts have as much sugar as a candy bar. A single serving of fruit-flavored yogurt can have 15 to 20 grams of sugar. Sugar raises blood pressure. It also feeds bad bacteria in your gut, so you must buy plain Greek yogurt. Read the label. It should have less than 5 grams of sugar per serving, and that sugar should come naturally from the milk, not from added sugar. High fructose corn syrup or fruit puree. Frank ate half a cup of plain Greek yogurt every morning. He added a handful of fresh or frozen berries for sweetness, plus his 2 tablespoons of ground flaxseed. He said he looked forward to breakfast. The natural protein kept him full until lunch. No more mid-morning snacks. If you do not like yogurt, you can try kefir, which is a drinkable fermented milk product. It has similar benefits. You can also try plain cottage cheese, though it has less probiotics. Aim for half a cup to 1 cup of plain Greek yogurt per day. Food number 3 is berries. Blueberries, strawberries, raspberries, blackberries, any berry, fresh or frozen but not canned in syrup. Berries are packed with compounds called anthocyanins. Anthocyanins are the pigments that make berries blue, red, and purple. They are also powerful antioxidants that protect your blood vessels from oxidative stress, the kind of damage that makes arteries stiff and narrow. Think of oxidative stress as rust inside your pipes. Berries clean that rust away. One very large study called the Nurses' Health Study followed tens of thousands of women for over a decade. It found that those who ate blueberries at least once a week lowered their risk of developing high blood pressure by 10% compared to those who ate none. But here is the best part. Another study specifically in older adults with high blood pressure found that eating 2 cups of blueberries per day for 3 months lowered systolic blood pressure by an average of 7 points and improved artery flexibility by 15%. That is a huge improvement. Frank added a cup of frozen mixed berries to his morning smoothie. He also snacked on fresh strawberries in the afternoon instead of cookies or crackers. He said the berries satisfied his sweet tooth. You can eat them plain, add them to yogurt or oatmeal, blend them into a smoothie, or even put them on top of salads. Frozen berries are just as healthy as fresh because they are frozen at peak ripeness and they are much cheaper. Just make sure there is no added sugar. Aim for 1 to 2 cups of berries per day. Food number 2 is oatmeal. Not instant oatmeal packets loaded with sugar and artificial flavors, not sugary breakfast cereal shaped like os or flakes, real, plain, old-fashioned rolled oats or steel-cut oats. Oatmeal is rich in a type of soluble fiber called beta-glucan. Beta-glucan has been shown to lower blood pressure in 3 different ways. First, it binds to cholesterol in your gut and carries it out of your body through your stool. That reduces the plaque buildup in your arteries. Clearer, less clogged arteries mean lower blood pressure. Second, beta-glucan slows down the absorption of sugar from your gut into your bloodstream. That prevents the insulin spikes that damage your blood vessels. When your blood sugar is stable, your arteries are happier. Third, beta-glucan helps your kidneys excrete more sodium. More sodium out means less water retention, which means lower blood volume, which means lower blood pressure. A large meta-analysis that combined the results of 28 separate studies found that eating at least 3 grams of beta-glucan per day, which is about 1 bowl of oatmeal made from half a cup of dry oats, lowered systolic blood pressure by an average of 8 points. Frank switched from sugary breakfast cereal to a bowl of plain oatmeal every morning. He added berries, flaxseed, and a sprinkle of cinnamon. He said it tasted better than the cereal he used to eat, and he stayed full until lunch. Do not buy instant oatmeal packets. They are convenient, but they are full of sugar, salt, and artificial ingredients. Buy a large container of old-fashioned rolled oats. They cost pennies per serving. Cook them with water or low fat. Milk. Add cinnamon for flavor. Cinnamon itself has been shown to lower blood pressure. Add berries, nuts, or a drizzle of honey if you need sweetness. Aim for 1 bowl of oatmeal, half a cup dry per day. And now food number 1. The most powerful, the most delicious, and the one Frank said was his absolute favorite, dark chocolate. Not milk chocolate, not white chocolate, not chocolate candy bars with caramel, nougat, or crispy rice. Real dark chocolate with at least 70% cocoa. Here is why dark chocolate is so effective. Cocoa beans are loaded with flavanols, plant compounds that stimulate your body to produce more nitric oxide. Remember nitric oxide? It is the same molecule that beets work through. Nitric oxide relaxes and widens your blood vessels. When your blood vessels are wide and flexible, your blood pressure drops quickly and naturally. A landmark study published in the Journal of the American Heart Association found that eating dark chocolate daily for 2 weeks lowered systolic blood pressure by an average of 5 points in seniors with mild high blood pressure. Another study found that the effect was even stronger in people with existing high blood pressure up to 11 points. That is as good as some medications, but you cannot eat a whole bar. The ideal dose is about 1 ounce per day. That is roughly 1 large square or 2 small squares from a standard chocolate bar. Look for chocolate with at least 70% cocoa. The higher the percentage, the more flavanols and the less sugar. 85% or 90% is even better, but it tastes more bitter. Start with 70% and work your way up. Frank ate 1 square of dark chocolate every evening with a cup of herbal tea. He said it felt like a treat, not medicine. And that is the beauty of this list. None of these foods are punishment. They are not bland or weird. They are delicious, everyday foods that most seniors already enjoy. Frank looked forward to his dark chocolate every night. That is how you stick with a plan. Aim for 1 ounce of dark chocolate, 70% cocoa, or higher per day. Let me put this all together into a simple, realistic, day-by-day meal plan for a senior. You do not have to be perfect. Every small change helps. But if you follow this plan most days of the week, you will see your blood pressure drop within weeks, not months. Let me walk you through a typical day. For breakfast, start with half a cup of plain Greek yogurt. Add 1 cup of mixed berries, fresh or frozen. Add 2 tablespoons of ground flaxseed. Sprinkle with cinnamon. That gives you 3 of your 7 foods right there. Yogurt, berries, and flaxseed. If you prefer a warm breakfast, have a bowl of oatmeal instead, half a cup of dry rolled oats, cooked with water or milk, topped with berries, flaxseed, and cinnamon. Either way, you are off to a powerful start. For lunch, have a large salad made with 2 cups of leafy greens like spinach, arugula, or romaine. Add half a cup of pickled or roasted beets. Add a small handful of walnuts or almonds for healthy fats. Dress it with olive oil and vinegar, not creamy dressings full of sugar and salt that gives you greens and beets. If you want protein, add a hard-boiled egg, canned tuna, or leftover chicken. For a mid-afternoon snack, eat a handful of fresh berries or a single square of dark chocolate. For dinner, include a serving of fish like salmon, mackerel, or sardines twice a week for their omega-3 fats. On other nights, have chicken, turkey, beans, lentils, or tofu. Always add a side of cooked greens like spinach, kale, or collard greens, and finish your day with 1 ounce of dark chocolate after dinner. Drink plenty of water throughout the day, at least 5 to 6 cups. Limit sodium. That means do not add salt to your food at the table. Avoid processed meats like bacon, ham, sausage, and deli meat. Avoid canned soups, frozen dinners, and salty snacks like chips and pretzels. Read labels. If a packaged food has more than 300 milligrams of sodium per serving, put it back. Frank followed this plan about 5 days per week. On weekends, he was a little looser. He might have a piece of pizza or a burger. His blood pressure still dropped from 182/99 to 110/70 in 6 weeks. You do not have to be perfect. You just have to start. And one more tip, keep a log. Write down your blood pressure every morning before you take your medication. Write down what you ate. You will see the numbers improve over time, and that will keep you motivated. If you have made it to the end of this video, you now have the same 7 foods that dropped Frank's blood pressure from dangerous to ideal in 6 weeks, but knowing is not enough. You have to go to the grocery store. Start tomorrow morning. Buy plain Greek yogurt, buy frozen berries, buy old-fashioned oatmeal, buy ground flaxseed, buy beets fresh, pickled or canned, buy dark leafy greens, buy a bar of dark chocolate with at least 70% cocoa, and eat them every single day. Click the like button right now so This video reaches another senior who is struggling with high blood pressure and facing another pill. Subscribe and turn on the notification bell. I post a new natural health solution every single week. Next week, I am revealing the one drink that seniors should never consume on an empty stomach. It is in almost every home. You do not want to miss it. Share this video with your spouse, your parents, your siblings, and anyone you know with high blood pressure. You could be the reason someone avoids a fourth medication and feels 10 years younger. This is Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room, reminding you that food can be the most powerful medicine you will ever take. Eat well, live long, and I will see you in the next video.